trying to fake it doesn't work. Human beings, as we all know, I know if somebody isn't really interested in me, doesn't really want to know how I am when they ask, or doesn't really want to listen to me, maybe doesn't have time. And that makes me feel uncared for, and it makes me not want to talk and want to tell them more. So there has to be a real genuineness about what you do.
I think generally as a nurse, you have to be very empathetic, very understanding, because you face different people every day. But when I became a psychiatric nurse, I actually realized you need that even more time to really think about what situation has gone on and why it has gone on, and then try and work towards it not happening again.
I think as a mental health nurse, it's being flexible, adaptable, willing to change to changing circumstances. I think it's important to keep talking to your colleagues, to the people that you're working with on a day-to-day basis, and it's having that sense of perspective really that okay, it is an important job, but we can only do what we can do, and I think maintaining that sense of humour if possible, and not taking yourself too seriously either.
Well, I certainly try as a nurse to work in partnership with our patients, and it is a bit of a, it's one of the words that the students will hear a lot in their training, but it's because it's so important.
It's fine and helpful often to bring aspects of yourself to the role. Certainly my sense of humour, I've allowed to be there on many occasions. Sometimes it's really helped. So be yourself, be a professional nurse, but also genuinely want to do what you're doing.
It's really important that you get that work-life balance right. Mental health nursing can be really challenging, and sometimes it's just the hours and what time you're working and how long you're working for. And we put a lot into it. So it's really important that you have those things that take you completely out of that world for a while. So I like to run. I do lots of running, I do half marathons, I just plod along and get rid of some of the things that might still be lurking around in my head at the end of the day.
As a mental health nurse, you need to be genuine in what you're doing. People can spot it if you're not listening to them, if you're not wanting to understand their experience, if you're not curious, if you don't genuinely want to be there and help them. And that can do more damage than not being there at all.
Get as much information as you can that's going on around, because people ask questions according to that. And for example, these days people can get anything from the internet. And so you got to be prepared, otherwise it becomes a difficult patient for you if they ask you a question and you've never heard of it.
I think I quickly learned when I started this job, I think within the first 6 months that I started mental health work, I learned that I shouldn't take things to heart. Because one, it's not going to be about me and it's not going to be for me. I can learn from it to improve my practice, but I shouldn't let it go into my system to bother me, even when things go wrong. The fact that I don't intend for things to go wrong is sufficient comfort for me. And touch wood, nothing has gone wrong ever till this date, and I hope nothing goes wrong from now on. But I don't take things to, I've learned that very, very early into my nursing practice. So that also helps.